This morning, we're tackling a crisis that is hitting closer to home than ever before. We're talking about teen substance abuse. A new report from Harris County Public Health reveals a staggering 74.9% increase in substance-involved deaths over the past 4 years, with fentanyl leading the charge. Well, for one local father, this crisis became deeply personal when he discovered his own son was struggling with addiction. Joining me live this morning is Dennis. He works at the Cheyenne Center. That's a facility that provides treatment for those struggling with substance abuse. And you told us that you're also in long-term recovery yourself.
That's correct, I am.
Thank you for coming on this morning and talking with us. So talk to us first about your initial reaction when you first learned that your son was struggling with abuse. You said he was 14.
Correct. That's where at 14, but he did confess later that he maybe started experimenting prior to being 14. But 14 is where I saw that he was actually struggling with it.
I mean, 14, you're talking 8th grade, 9th grade, and what did you learn? How did this come to your attention? How did you find out about it?
Well, I actually was initially shocked. I went into a lot of defense mechanisms there. Well, okay, it can't be that bad. Maybe there's some understanding about the contraband that was discovered incidentally, and that's how it all came and was unfolded. It was through peers. It was actually going through people at school and surrounding elements right there. And it seems to be, like you stated earlier, a very serious chronic problem that's just hitting our community at 10 times fold. I
mean, Dennis, you do this for a living.
Yes, ma'am.
And you didn't discover it. You said that it was 14, but he said that he had been experimenting since he was younger than that.
Correct.
Were there the signs or incidents, you said paraphernalia, that you found in his belongings? Can you talk a little bit more about that? And what should we be looking for with kids?
Absolutely. And to start off, you're correct. I've been with the Cheyenne Center for 20 years. We do wonderful things with substance abuse and addiction counseling. I'm in long-term recovery. You would think with all that experience, I would be able to pinpoint. The reality is addiction doesn't discriminate. They don't care what I know. They're going to go ahead and attack whoever they can that's susceptible to it. What was discovered was actually when an actual piece of contraband fell out of his pocket and his sister noticed it. It was in the shape of a highlighter. They're targeting all kinds of clever ways. And from there we discovered how long he was using, and then actually got into some dealing also. The whole world that comes along with addiction was the horrifying part.
Yeah, I mean, I don't mean to talk specifics, but was it, marijuana? What in the shape of a highlighter? I mean, what kind of drugs? Because we hear fentanyl, but as a parent with a 13-year-old, I'm thinking they're not actually intentionally taking fentanyl. They're taking some other kind of drug that ends up laced with it, right? More
than likely, that is correct. He started off with some very high levels of THC, which is different now than it was, let's say, as recent as the 90s or even 2000.
Yeah.
There's highly doses of THC along with other hallucinogenics that's in there. And the difference nowadays is fentanyl is laced, many things are laced with fentanyl. And as a parent, this is one reason why I was very grateful to be on the show, is we got to give our kids and our families a fighting chance through education, knowing what is out there, because there's always going to be progressive growth in that chemical dependency drugs.
Right. I mean, and I got to be honest with you. I mean, passing down every block you pass a THC delta 8, what's the difference? I don't know. And then your kids are hearing about these things in school. Once you found that item, had a conversation with your son, I mean, what does it look like? Walk us through the process of trying to get help and treatment for a young child. I mean, somebody who's just entering their teenage years.
Well, one first step, me being in long-term recovery, I did have an advantage. I actually said, he's not going to be the only one in treatment. I've got to go ahead and watch my reaction. You said an operative word, struggling. And I can't keep that with any child that we have as a parent. If they're struggling with something, we naturally want to help. I had to learn how to help, and through my own recovery, and of course, professional, learn some techniques. I need to assist. I need to reach out for help. This is not the time to do the blame game. I do believe in consequences, natural ones, and accountability, 100%. But this is the time to help them with that struggle. I can't compete with all the things that are out there. You mentioned some of the Delta 8 and all this. I can't keep up with that stuff. So what I have to do is start in the home, educate myself, reach out to some other parents so we can get a fellowship going, and talk to the kid and keep that communication open always.
Yeah. So how is your son's journey with addiction? This has been about 2 years now? He's 16 now.
Correct. He's 16. So far, he's, I think it's a little over 22 months. Lord willing, on February 8th, he'll go ahead and celebrate 2 years. And he's working with other adolescents also and sharing his experience. And that is where you really see the lights coming on as far as the appreciation of what he's involved in. There's a difference of receiving recovery and education, but when you can turn around and help somebody and you see the lights come on in their eyes, that's when you really feel connected, that you're a part of this recovery community.
Right, so he's still very much involved. I mean, now he's helping others, but does he continue to go for, I mean, what is it? Is it like therapy, or what sort of did his support involve to try to get him over that?
I was very fortunate to find this organization called Teen and Family Services. They do wonderful things with adolescents. When I first went, it was kind of new because I deal with Transcend deals with adult offenders and adult people in addiction. Teen and Family Services primarily focus on adolescents, and their technique is so warm and opening. The number one thing I felt was the kids could tell this is not a place of judgment. And that fosters an environment where the kids are open to go in and talk about the issues instead of trying to worry they're getting in trouble.
Yeah, so what advice would you give to parents who suspect that their child might be using drugs or any type of substance that they're concerned about?
I would say, and I speak directly to the parents here, just from me to you, I don't know where I'm at, but be bold. Be bold. Make sure that you do not go ahead and try to defend and rationalize, justify, not my child, quite possibly, yes, you're a child. Be bold to fight every instinct we have into minimizing or choosing not to see something, because it is a very scary topic right here. But be bold to reach out, and I tell you, find a recovery center, find a parent support group, and you may go ahead and try to prove us wrong, saying that your situation is unique. The only thing I ask is give us a chance to go ahead and prove that maybe we're more similar than that is comfortable, and we'll be able to guide you through the long-term recovery process.
And the Cheyenne Center, you're right here in Houston?
Yes, ma'am. We're on the north side of Houston, just off the 59 freeway in Little York. And again, we have multiple programs. Our largest ones, we try to help the offenders that come out of prison, the criminal thinking and abuse. We also have another program with our HHSC program. That's an indigent program. We welcome anybody that feels they may have a substance abuse problem, slight emotional disturbances, and it's a residential adult male treatment facility.
Okay. And Dennis, just talking about teens, I know we're going to wrap up here, but it's so difficult because that 12, 13, 14-year-old stage is when you're thinking, okay, they need more independence. They need to be able to, make some of these decisions and mistakes on their own. I'm not talking about drugs, but you're giving them a little more of that independence and trying to pull back from sort of the hand-holding. And then I feel like that's the dangerous time when they're experimenting.
Correct. The ironic thing is that by entering a field of recovery, they're actually going to get their true independence. The thing that I first noticed with my son was we had a thing where we'd stay up late and watch movies. And one time he said, "Dad, I'm going to go ahead and give me a minute." He was in his room and he was actually using. By the time he came out, I was already passed out asleep. It may seem trivial, but that really hit him. And what I noticed, and he was trying hard not to cry, of course, sharing it later, he said that is when he realized that drug abuse wasn't interfering with his ability to love, it was controlling it.
Yeah.
And that's a codependent and hostage situation.
Yeah.
So.
Dennis, very important information. Thank you so much for sharing your story, and hopefully parents hear it this morning and heard something that helps them with their teenagers. We're going to hear more about your story. Corley Peel has another story, another report today about teen substance abuse.